Hello everyone and welcome to OPG Hub. I'm so excited to see all of you. So as I'm recording this video, there's a cholera outbreak in Ghana. So I decided to do this video specifically to help you understand what cholera is about and how to get rid of cholera. So before we move on, I want to tell you a quick history about cholera. So cholera, in the world of germs, the Vibrio cholera decided that okay, I want to go out and do a world tour. Starting in India from 1870, there was a cholera outbreak which spanned to about 7 pandemics in history. It shook cities, towns, and countries. And here today in Ghana, we are also having cholera outbreak. Cholera is a waterborne disease and it's caused by a small microorganism called the Vibrio cholerae. Don't let that small size deceive you. Contaminated food, contaminated drink, poor sanitation are actually its hangouts. So what I'm trying to say is that the bacteria can be found in dirty water, contaminated food, and also poor sanitation. So if we are to tackle or treat cholera, we are supposed to tackle this contaminated water, contaminated food, and poor sanitation. So the bacteria, the Vibrio cholerae, enters into your system when you consume this contaminated food and water. It goes straight into your intestine by skipping the stomach acid. So the bacterium survives the stomach acid and goes straight into the intestine. Once it's reached the intestine, it attaches the intestinal walls and releases some chemicals called cholera toxins. So this toxin tricks your intestinal cells to release some chemicals. What this chemical does is that it disrupts the way the intestinal cells handles water and salt. So there will be a large production of salt into the intestine or the intestinal lumen. And what will happen is that where salt is, water will follow. So there will be a lot of water following the salt that is being produced. And that's what leads to the watery diarrhea that is being produced. Usually the watery diarrhea is like rice water. If you are eating, don't goggle it because you don't like what you see. You lose water and salt at alarming rates. If left untreated, can lead to a lot of complications, including death. So cholera is very serious and we are not supposed to joke with it. Now let's look at some of the signs and symptoms that you begin to know that I have cholera or you have cholera. Passing of watery stools, vomiting, taste, leg cramps, and restlessness. If you notice any of these signs and symptoms, kindly report to the nearest health facility. So now, how to prevent you from getting cholera or how to stop cholera? If you remember, I talked about 3 things: contaminated food, contaminated water, and poor sanitation. Do you remember? And so to stop it is save water, save food, and good hygiene. Save water. You need to treat water well so it will even treat you better. You need to boil just drinking water for at least 3 minutes. And in the case you are not drinking it at the moment, kindly keep it in a sealed, clean container and cover it. Also take note that if you are using a bottled water, make sure you cover it well, preventing exposure to the environment. Save food. Wash it, peel it, cook it. Wash your fruits and vegetables with clean running water. Peel fruits before you eat. And if you have to cook it, ensure you cook food very well before you eat. Make sure the food is hot before you feed on. This will help kill all the microorganisms so you don't eat cholera containing food. The next is good hygiene. Ensure you wash your hands under running water, clean running water of course, with soap. Before and after visiting the toilets, before and after eating, and in case where you don't have water and running water, you can use ash in place. Avoid open defecation and avoid indiscriminate disposal of your refuse. All these are good hygiene practices which will prevent cholera from coming in your environment, affecting you, and leading to the severe complications we have talked about. At any point, if you have sudden diarrhea and vomiting, kindly rush to the nearest health facility to receive treatment for all you know, that is cholera. I hope you enjoyed every bit of this video. Ensure you pass this video to a lot of all our friends, especially those who are at the hotspots, the Western region, Central region, Greater Accra, so we can all get ourselves prepared, armed, and we'll be free from cholera. Don't forget to like and comment, and if you are new here, don't forget to also hit the subscribe button and the notification bell to always get updated anytime we post our amazing content. Until then, see you.